we've seen like kids with bedwetting and we address sleep and all of a
Hmm.
sudden
Yeah.
the bedwetting goes away.
Yes.
Um, the disordered sleep definitely affects, I feel like, bladder control, muscles, um, the ability of the diaphragm to move, which the pelvic floor coordinates a lot with the diaphragm. So it's just an interesting connection that it's like, if I have a kiddo that's bedwetting, I'm like, we're ruling out two things first. One, we're ruling out constipation. And then second, we're looking at, okay, is there a sleep issue?
Millions of women are living with pain, discomfort, and silence, told that it is just a part of life. It doesn't have to be. This is Healing at Your Core, where pelvic floor physical therapist Bree Allred brings more than 20 years of clinical expertise to the conversations women deserve to have. Real answers, real healing, no shame. And now, your host, Bree Allred.
Hi, everyone. I'm Bree Allred with Healing at Your Core. We're so excited for our guest today, Dr. Mike Bennett. And Dr. Bennett, go ahead and just tell us a little bit about yourself.
Oh, thank you. Well, I am a happily married father of four children who are now adults, and they have given us 10 beautiful grandchildren. So that's the happy side of my life. But professionally, I've been practicing aspects of dentistry for 27 years. I'm board certified in pain disorders, jaw, TMJ, and also dental sleep medicine, like snoring and sleep apnea, and been enjoying my career. And also just been able to interact a lot with my colleagues in helping people with chronic pain. So I'm excited to discuss this with you today.
Yeah, I'm super excited. So, this episode, people may be shocked to find out that there is a connection between the jaw and the pelvic floor. And I want to explore a little bit more of this, also how it's affected through the nervous system and through breathing and these connections that we can find through our core and how they affect each other. Um, so tell me a little bit about your journey into more of the chronic pain, the TMJ, the airway. What led you that direction in your dentistry practice?
That's a great question because early on I found that people would come into the dental office and have these conditions of cracked teeth, worn down teeth. Mm. We would fix those areas and then they would come back, 12 months later and find that the dental work maybe has broken or they had additional teeth that were continuing to break down. And that led me to ask the question, well, what causes this excessive force in the mouth to break teeth? And the research indicated that there's reflex activity that occurs while a person's sleeping, that if their nervous system is activated into a sympathetic fight or flight drive for whatever reason, then you'll have this excessive movement disorder and teeth mashing against teeth. And as a result, that caused the breakdown of the dental structures. And I thought, well, why am I chasing symptoms? Why not try to figure out what is at the root cause causing that movement disorder that's breaking teeth? And it turns out that a lot of it was breathing disorders. When you don't breathe, your body goes into this reflex activity, and that results in that breakdown. But it's also many other things like PTSD and chronic pain throughout the body, or nutritional deficiencies can trigger that movement disorder. So that led me to thinking, well, I could either chase the symptom, I could make plenty of money doing that, but that's not the best thing for the patient. And so I want to get to the root cause, fix their symptoms, protect them life for a lifetime, and so they don't have additional breakdown, and then work into this interprofessional type arrangement with other providers so that we get people breathing, get people sleeping, address their PTSD, their nutritional disorders, their injuries throughout their body, like, you and I can do together. And then they're not going to break their teeth down. So that's
Yes.
kind of in a nutshell.
So interesting because we're very much alike in that we like to get to the root cause. And that's part of this healing at your core. It's like, yes, we're going deeper. We're getting to the root cause. We're not just treating symptoms. So I love that you brought that up. Um, tell me, um, tell me a little bit more about why the face and the jaw matter so much to the Bree.
Wow. Well, you just have to study the neurology to get a good idea of what's going on because a predominant amount of your sensory cortex of the brain is devoted to the face. When you stop to think about it, the face is where we survive. We reproduce starting with the face. It's the beginning of the digestive system and the respiratory system. And what's more important to the human body than breathing and nutrition, right? So the
Being
sensory nerve,
alive.
yeah, staying alive, survival. And it's been said that the brain is all about survival. It knows how to kick it in to protect the human being. Um, but the trigeminal nerve is the largest of all the sensory nerves and that feeds the face and it protects the face, jaw, tongue area. So if there's any injury or any functional disturbances in that system, that's, this part that where that big, huge sensory nerve is, then it's going to activate the central nervous system easily and put somebody into a fight or flight more quickly. And anecdotally, I'm thinking hypothetically, but clinically I see it all the time. If I can get the face right, the jaws right, the airway open, protected, it's amazing. People start to heal fast.
Yeah.
They start to sleep
Yeah.
better. Yeah.
And I would say, arguing from a pelvic floor standpoint, so you're talking about all of the entrance for the nutrition.
Hmm.
My end is talking about all the exit for the toxins that can kill you too. And the other end of reproduction, right? So these very similar aspects where it's like we have muscles that are surrounding two ends of the very vital tube to our body,
Okay.
right? And very vital um, bodily functions, and very, like, we are biologically wanting to reproduce. So from
Hmm.
all of those aspects, I'm like, it's so similar where we're just looking at two ends of the body, and
Yeah.
very similar aspects there that are very highly connected to the nervous system.
Well, yeah, and that makes it a bidirectional thing. So, for example, I've had lots of patients with urinary tract infections or other processes. Let's say they've had a really tough delivery and they've torn that pubic symphysis is separated, never came back together. And so they've got this chronic inflammatory issue in this part of the body. Well, it, it's interesting how that injury can trigger more bruxism, more movement disorder. And so to fix the jaw, I've got to fix the pelvic floor, got to fix the pelvis, got to fix those injuries. And so I can't be successful without somebody like you doing your job as well. Just to take away that trigger.
Yeah. It's a whole body system.
Hmm. Yeah.
Yeah. That's
Yeah.
such a difference there.
So that's it. And it's also interesting that I don't know, I have about one out of 10 patients are males, 9 out of 10 are females in my practice. Do you work with any males in your practice? Is it
I
strictly
do as well. I would say, about, with our caseload, we're probably 10 to 15% male. Um, so I mean, very similar. You're saying 1 in 9. I'd say
Hmm.
about 10, 15%
Hmm.
of our caseload is male. Because I'm like, males have a pelvic floor too. It's
Yeah.
just a little less susceptible to injury based on childbearing, menopause, hormonal changes that are different for females. But
Hmm.
yes, we definitely see things with males as well.
Because I'll often see like somebody will come in and say my jaw hurts or I've got migraines, so I've got primary headaches types conditions, and when I go in and I help them with that, reduce their pain levels, they tend to start sleeping better. And those who are in the childbearing years who are trying to get pregnant, it's interesting. You get people sleeping better and reduce their pain. It's amazing how fertile they can become because the body's primed for it. It's like, okay, now you can sleep. Now you're producing enough growth hormone during sleep that you can create another human being within your own body. Whereas it is right now, you can't because you're not sleeping well enough to take care of your own needs of growth hormone and
Yeah,
prolactin and so forth.
yeah.
I see that.
It's when your body's in survival mode, it's not going to reproduce. It's
Yeah.
like, we're not bringing something into that. Yeah,
I joke with
absolutely.
my staff and say, "Hey, this is the TMJ fertility clinic," because people tend to get pregnant after they get pregnant.
So neat. Just to see those connections, though, that it's like the nervous system definitely affects
Mhm,
things both on the male and female side of
mhm,
things from fertility standpoints as well.
mm, mhm. Yeah, I
Yeah.
love that.
So your focus when you're working with this to get people breathing better, how do you go about that? What does it look like when you're like, okay, your airway stinks, you're not able to breathe well, you're not able to sleep well? What are you looking at in order to help correct that?
Yeah, great question. Because it's basically, let's ask the question, where is the blockage? Where is the obstruction in your airway? So we image the whole upper airway, essentially from the tip of the nose down to the hypopharynx, vocal cord area. And if there's any constriction, pinched areas, then we'll make a plan for it. And so I've got a team of airway doctors who include pulmonologists, sleep physician, allergy specialists, nutritionists, and all of us. And I do my part because frequently, probably most frequently, the pinched or blocked area is in the retropalatal, retroglossal, behind the tongue palate area. And so I'll do some procedures, oral devices, and some other things to open up that airway. Also includes myofunctional therapy to develop the musculature tone so it doesn't collapse so much. And then I kind of act as the advocate for the patient and refer them to other specialists to get the rest of the work done and for the physician to oversee, the whole process. So that's kind of the next step. There's so many people are put on CPAP automatically, and it's a good thing. It's just difficult to tolerate a mask and straps on this already tender area of the body. And so that frequently is the question is, well, where's the blockage? Let's make a plan for it. If we do, right now you're breathing just fine. They come into the office, they're breathing great. It's just when they sleep, they don't breathe great.
No.
So
When
I've got,
tissues and structures relax, it can affect
yeah,
things.
yeah,
Yeah.
absolutely. Yep. Yep. That's what we do. So usually it's like a 5 to 6 month period where we're working together. I'll make the oral device. I'll do additional sleep tests to titrate or adjust the device, and then recommend over-the-counter things, simple things to open up nose and throat areas, and then retest to see if it's working, and then they go on to the next specialist if things aren't working out as well as I expect. There's non-responders, and then maybe 5%, 10% of the time, people are like, "Oh, I just can't wear this thing in my mouth." And usually it's because they can't breathe through their nose. And then I'm sticking a piece of plastic in there and blocking their emergency breathing holes, you
And they're
know?
like, I'm going more to fight or flight
Yeah,
with that.
exactly.
Yeah.
But it's interesting, in addition to the nasal being a cause for not tolerating the device, so often it's an injury in their body. And I would think, especially in those nerve-rich areas, the reproductive areas, that if things are agitated there, that reflex to clench and then have a device in your mouth that you're going to clench on, it's a lot of irritation. And I think another reason why people don't tolerate their oral devices because they're just irritated from other injuries throughout the body. So another reason why I might send somebody to you to be checked out is she can't wear a device. She's bruxing on it. She's complained of a history of pelvic inflammatory issues. Hey, can you help her with that?
So it's really neat when you're starting to look with different aspects of things.
Hmm.
Um, I love this. We've seen like kids with bedwetting and we address sleep and all of a
Hmm.
sudden
Yeah.
the bedwetting goes away.
Yes.
Um, the disordered sleep definitely affects, I feel like, bladder control, muscles, um, the ability of the diaphragm to move, which the pelvic floor coordinates a lot with the diaphragm. So it's just an interesting connection that it's like, if I have a kiddo that's bedwetting, I'm like, we're ruling out two things first. One, we're ruling out constipation. And then second, we're looking at, okay, is there a sleep issue that's underlying that? So it's
Oh
kind
my
of
God.
interesting. And if we get those addressed, oftentimes things will improve. And if not, then that's where it's like, okay, now the pelvic floor is the big driver for this. And we're going to be looking a little bit more closely at rehabbing and working with that.
Oh my gosh. I love that you're saying that because that's one of my favorite things is to do expansion for kids, get them opened up, breathing, nervous system starts to relax, that peristalsis of the GI tract starts to work again. And yeah, yeah, for sure. Blood pressure drops. Yeah, it's an
Because we
amazing
start,
concept.
when you look at the real basic, we say the nervous system responses, right? Sympathetic is where everything's fight, flight, freeze, fawn, right? I think are the main ones where it's like, those are what people will do in those situations.
Hmm.
And when we're in parasympathetic, we're looking at it's resting and it's digesting. And so if we're not able to get the nervous system down, that can be a contributor to the constipation that might be
Mhm.
driving or underlying some of these issues as well.
Mhm.
Yeah.
Yeah. Yeah, I love that, and I love that you bring up for breathing, because breathing is different in the fight or flight versus the parasympathetic. Yeah, diaphragmatic breathing, and because I'm all about trying to get people to breathe, and I'll use that technique called butycal breathing to help people get into that diaphragmatic breathing. But I can see how when they're in fight or flight, how it'd be more upper quadrant rib cage breathing, not diaphragmatic. It's just emergency breathing, get that air in because my brain is deprived of
Yeah.
oxygen.
Because we're seeing a lot of movement
Mhm,
here, right? Versus down in the belly or deep into, because there is rib cage movement still with diaphragmatic breathing, but it's more
mhm,
downward and opening rather than it being doing this really tight and upper
mhm,
chest. And we could even look just from a muscular standpoint, even from what you're talking about with the jaw, right? You're looking at all of these neck muscles, this upper rib cage. Do you know what I mean? We call them accessory or not primary breathing muscles, but in certain situations they will help, and that will promote more tension through here. And then it all of a sudden, doing affects into that jaw and starts kind of changing how things are working
mhm.
there.
Yeah.
Yeah, from a tension standpoint.
Oh, yeah. Well, I find that the nose is a key player in that because the nose heats, humidifies, filters the air, and it mixes nitric oxide with the air as it's inhaled, but the mouth does not do that. And so when you get into these emergency breathing situations, you get lower oxygen levels and you get dirtier air going into your body when you mouth breathe. And then the body has to cope with this pulmonary reaction to aspirating stuff from your mouth into your lungs. And so one of the primary drivers of this sympathetic state is going to be mouth breathing and the subsequent, etiology of low oxygen because you are mouth breathing. And so that's one of the big keys is my ENT is like gold, where they can get people breathing and the allergy specialists get people breathing through their nose to allow for those functions of heat, humidify, filter, nitric oxide secretions. And then you get this good gas exchange. The air coming in through the nose gets all the way into the alveoli, gas exchange, better oxygenation. There's a book from James Nestor called Breathe. I thought is excellent. He's a scientific journalist. Have you ever heard of that one?
I haven't, so I'm gonna have to read that one now.
Yeah, you should check it out. I did a podcast with him, interviewed him a while back, and he's onto it. I mean, he understands so much that the body cannot go into parasympathetic rest and digest state and well enough if you can't nose breathe well. We're supposed to be nose breathers, not mouth breathers. Only emergencies we mouth breathe. When the grizzly bear is chasing us, go ahead and open up. But all night long, that has to be open. And so that's one of the key principles is you kick in diaphragmatic breathing if you can nose breathe well, you know,
Yes.
and you can relax the nervous system to nose breathe well too.
Oh, great. And I love that you say that it's like it's taking a team. It takes a village. Just like we say to our mamas, it's like it takes a village to raise our kiddos. And I think as practitioners, it takes a village to take care of our patients, right? From all of our different specialty areas. And I love that you already have that team built, which is a really neat thing. It's not a like, well, okay, now you need to find somebody to do this and you need to find somebody. It's like we have these teams in place and we have these referral systems that we know that we all speak the same language per se, and that we're all have this common goal in mind. So I love the fact that you're like, oh, we've got a pulmonologist, and it's like, okay, people with asthma, people with, do you know what I mean, lung conditions, that's going to affect what's going to be happening in their airway as well, and how they're choosing to breathe. So you need that aspect of the team on board. And you're saying like, okay, you as the dentist, you're looking at the physical structure of what's happening from a jaw alignment and from
Mhm.
palate and all of those aspects. And then you were saying, ENT, who's looking at the ears, nose, and throat, and who's looking at, and it's just I love this comprehensive care that it's like we're all bringing our specialty areas to work together, and that you have that in place already.
Yeah, they don't really teach that in school. At least I don't remember hearing that. It's maybe they did teach it, but I was so focused on passing the boards, on those things. But yeah, you're absolutely right. The treatment outcomes are so much better in a team environment versus somebody just trying to go at it at their own. and then moving forward if they don't get the outcome that they
Yeah.
want. Yeah.
So neat to be able to have that aspect. And like I said, that a patient isn't left doing that independently all by themselves. Because sometimes putting that team together, that's like, you go see somebody and it's like, well, I don't really see what you're talking about. And it's like, okay. Versus you having that in place where you have trusted providers that's there.
Hmm.
It's
It's
really neat to, to hit that multimodally. And I do feel as people are getting more and more specialized in their fields, they're getting better and better at what they do. But then oftentimes that allows the patient themselves are kind of stuck with like, well, I only have one piece of the puzzle and I need all of these pieces of the puzzle. Um, so I don't really have a great general provider that focuses on airway and breathing and opening that up. So it's just such a huge, I can't emphasize it enough, just the importance of that and that you already have that trust in place is really neat to hit it from all the different specialties to where it's like, yes, you have the maximum benefit because you have these amazing, highly specialized individuals working as a team together. So you're getting everybody's expert knowledge working into one whole.
Yeah, absolutely. Can't do it without your team.
Yeah.
Where do you practice?
So I'm in Logan, Utah, in northern Utah right now. Yeah.
Oh,
Um, and we're looking to expand at some point. So if you know any great pelvic floor PTs looking for a job, like we need somebody. Um, and yeah, just a really neat kind of overall arching thing. So when you have somebody with an elevated nervous system, what would you say are your go-to things that you're looking at? Obviously, one is like, can they breathe well? But when you're
uh-huh.
looking at that from can you breathe well, what are you ruling out? What is your process to go through? That's like, oh, this is how I can get somebody to breathe well. And then
Mhm.
here's how I'm addressing their nervous system in other ways.
Well, I've got to take a really good history. I got to find out what symptoms they're dealing with. And oftentimes, you had alluded to a few things like bedwetting, but there's also irritability, underperforming in school, just unable to, pay attention, attention deficit disorder, or hyperactivity issues. And so, when it comes to children, I'll have the parents fill out a little questionnaire that is, hey, observe your child for 2 weeks and see what they're dealing with, what they're doing. And then we bring them in, review that, and determine if there's enough grounds after looking in their mouth, their throat, if there's not enough room for their tongue. There's a small mouth means small airways. So I'll I'll do a sleep test if there's enough, and I partner with a board certified sleep doctor who reads the sleep testing data, and then they'll render a diagnosis on what's going on. And so we'll know officially if there's a breathing disorder. And with children, it only requires 1.5 events per hour, meaning if you stop breathing or pause breathing more than 10 seconds 10 or more seconds and your oxygen drops 3%, that's considered one sleep apnea event. And it's so bad for children to have sleep apnea that they've defined sleep apnea in children at 1.5 events per hour. And so we'll get that data. And then and most often they do have a breathing disorder, then we'll look at the x-ray, find out where the issue is. It's typically underdevelopment of the jaws, which then begs the question, why are so many people underdeveloped? Why don't people have their wisdom teeth? Did you have your wisdom teeth taken out?
I did.
Yep, me too. It's like 90+% of the population in America have their wisdom teeth taken out, or it's probably close to that. And why are faces shrinking? Why are they small? 400 years ago, the skeletal record showed that people had their wisdom teeth. They may have died of a tooth infection, at age 40 or whatever, but they had all their 32 teeth and spaces between them. And these days our mouths are small. And when you look at the anatomy location of the mouth, it sets under the nose and in front of the throat airway. And when it's small, those structures are also small. And so we're already susceptible to these small jaws and faces because there's lots of reasons: lack of breastfeeding, nutritional issues, durability of foods. We're eating soft foods, Cheetos. And so the musculature doesn't stimulate the bone. The bones don't grow. We have small mouths, jaws, and that consequently results in a small airway. So that's a long way of saying, yeah, this child is developing in a way that's prohibiting good breathing. And so we need to try to reverse the underdevelopment of those structures. And so let's, for example, they're diagnosed to sleep apnea. There's options. They can go in and have body parts removed, like tonsils and adenoids, which in some situations you want to remove those because the child is in such distress. You want to take those out. But I find more often than not, expanding the airway, talking about eating whole foods, getting the patient sleeping, drinking enough water, sleeping enough hours, those basic things that'll result in a lot of the the shrinking of those lymphoid tissues, and then they start breathing better. And so that's sort of the start and the finish. You got a ADHD child, treat their airway. At the end of it, they're sleeping better. They wake up, their brain is, versus before, their just brain is overly tired, and now they're very rested and they can be themselves. The real child comes out finally when that child starts to sleep. And it's a beautiful, beautiful thing.
So if you address the airway and you still feel like somebody's nervous system is ramped up, what would you say is kind of your next steps that you look
Yeah.
at?
So it's not as simplistic to just say only airway focused, obviously. So I'm going to stand them up and I'm going to look at their posture. And frequently you see this forward posturing, those scapulae turned out, loss of kyphotic curvature in the spine. Yes, that's exactly it. And so that creates injury in the body, and that malalignment needs to be addressed along the way. And what I found is once you get the airway opened, posture during sleep improves. Therefore, posture during the day actually improves. But sometimes you still need therapy to get those structures into alignment and get the muscles stronger, the core, helped out. And then you got to get the injuries out of the body and addressing each of those restrictions and range of motion and so forth.
Yeah.
So yeah,
And that's where physical therapy comes in beautifully
Mhm.
to help and assist with
Yeah.
that. We will also, like, just from my experience, I can't say every physical therapist is trained, but we can do some stimulation techniques of the vagus nerve, which the vagus nerve is a really great on-ramp to a healthy nervous system, to bringing things back into a parasympathetic space. But then it's like, just like you said, therapies from more of an emotional and mental standpoint. Is the body holding on to trauma from certain things from a mental health standpoint or an emotional standpoint that we may need to address? I've seen chiropractic come in as well from a nervous system standpoint to help things from a whole body nervous system standpoint as well. So it can be really neat. And then there's yoga practice and meditation and all these other things that I think can be hugely beneficial. And I love having a toolbox so that it's, that one's not going to work for me. I'm not going to meditate. I'm like, okay, let's find something else that will work for you that you can access, that you can do on a regular basis.
Oh, that's so good. And so you got exercises, you got at-home activities they can do to kind of maintain and sustain. Yeah. I think that's beautiful when you can give a person the gift of independence so that they don't have to rely on you or me, that long term they can do stuff at home, the good healthy practices. Interestingly, I find that a lot of kids are dehydrated too. Like next to air, what's more important to the body than water? So it's, hey, let's start focusing on getting a little more hydration, especially during these hot days.
I really do think that there's some simple things. Like you said, like, let's eat more whole foods, right? Let's get more water intake. And oftentimes it doesn't even have to be, because we hear that and then we're like, oh, okay, we have to do like a really good healthy diet and we have to do lots and lots of water to where I'm offering it to my kid every hour. And it's like, no,
Good.
it doesn't have to be this big grandiose thing. I usually tell my patients, I'm like, from a constipation standpoint, they've shown differences with 16 ounces a day, which
Mhm.
I'm like, okay, can you offer your child a glass of water 2 additional times a day?
Mhm.
Like, is that doable? Maybe it's, like, right as they're getting up in the morning, and maybe it's you're making a little bit more emphasis to have a drink with your meals. Maybe it's, right, getting them a cool water bottle that they like so they'll carry it around with them. These all work for adults, by the way, too. We're just big kids. And, with Whole Foods, it's like, okay, can I add a fruit or vegetable to a meal. And it's kind of finding things that you like, where it's like, oh, okay, for breakfast, could you add some strawberries to it?
Mhm.
For lunch, could you offer, I'm like, I tend to go more towards fruits, but could you offer, do you know what I mean, some ranch and carrot sticks?
Mhm.
Can you, because the more it's offered, the more we're exposed, the more we're wanting to usually eat those foods, or the more willing from a kid standpoint that we are to
Mhm.
try. So I just think it's interesting that's like, it doesn't have to be big and grandiose oftentimes that we think that it's like, no, these small little changes and just making an effort one different time of day can really make a difference there.
No, I love those little ideas that mean everything. Yeah, like my wife is a nutritional expert, and she went to the dollar store, got one of those little veggie tray things with the covers on it. And so she'll cut up veggies, cauliflower, broccoli, celery, carrots, put them in that. And so we have grandkids that come over, and even with us, she'll pull that out. That's the first menu item for lunch, breakfast, dinner, even breakfast. And she's always saying, well, if we can get the fiber in, that becomes the vehicle for all that glucose. And then you're not going to have such a spike in insulin, from the food you're eating if you start and end with a veggie and get that fiber in. And that's been really good. And not only that, from a jaw standpoint, if the child's biting on durable foods, they're activating muscle and bone grows, they'll have better development in their face just from eating more vegetables and taking time to chew those vegetables too.
Yeah. Slowing down, actually paying attention to the foods we're
Yep.
eating and being on a device. Yeah.
Oh yeah. We can save lots of parents orthodontic bills if they do a lot of this stuff we're talking about.
Tell me kind of the 9 to 1 females to males. Do you have any theories behind that for within your practice that you're seeing that? Is it more just we tend to have a smaller jaw structure? Is there stressors in the female life that might be a contributing factor to that? Tell me, do you have any theories behind that, or is there any
Yeah.
research?
I definitely have thought about that a lot over the years. And a couple of things. One is they have different neurology. There are a lot more nerve receptors in the trigeminal area, especially in the joint capsule. I mean, they just feel it more. Estrogen tends to elevate pain response, whereas testosterone tends to mitigate it. And so men are just as messed up from a TMJ standpoint. They just don't feel it. And so when a man comes in, it typically is very advanced, like bone on bone, arthritic changes, loss of articular disc space, and all kinds of things. And so the ladies just feel it more quickly. So that's one item. The other item is unfortunately there is PTSD in the world. Life happens, and that stress response, and often those things are happening toward women and girls that you have to keep that in mind because that can trigger the movement disorder, the reflex response. And so it's not uncommon for me to ask a few brief questions. Is there anything in your life that you're just holding on to that, and just kind of, and as a way to screen out for any PTSD. And then if there is, like, part of our therapy needs to be, you go to talk to somebody you trust and you love and who loves you, and or a professional therapist, anybody like that, and work that through, because that's part of the solution. Is we've got to make sure that you're dealing with those things that can trigger the movement disorder that causes the jaw injury. So PTSD and definitely airway related things are often related to that, and the neurology. Those are three main hitters when it comes to causing females to be a predominant patient in the practice. But interestingly, being parents, like, it's not uncommon for a mom to come in and say, okay, I was leaning over my 2-year-old and they stood up all of a sudden and just bam, hit my chin. Shoves those condyles back, and they're like, I can't open my mouth anymore. And so actual trauma, macro trauma, it's uncommon, is actually very common.
So children, again, we love them.
Start to finish, they're traumatic on all of us, right?
Yes.
There's
Yes.
no
But we
real,
grow because of them so much. We love
right?
them. Yes. Yes. Okay, if you had just kind of a general message that you wanted to tell all of our viewers, what would it be in relation to you could say airway or health or jaws or things there. If you had, whether it be some advice or just something that you'd want them to know, how would you answer that?
Bree, great question. The message I would have them hear is that the human body is designed to heal itself. And there are healing properties within the human body that if we unlock those, then any therapies that you or I do, they'll tend to be magnified. They'll be much better. And so how do you unlock healing properties in the human body? Well, the body heals during sleep. Everybody knows that. Like 10 out of 10 people, if you ask, when does the body heal? Is it while you're awake or while you're asleep? They'll say, while you're asleep. And so one of the keys, if you're dealing with chronic issues, if you're suffering in any way, emotionally, spiritually, physically, then you ought to look at your sleep. Is that working for you? Is it optimal? And if it's not, what can we do about it? So how do you test? Well, do sleep tests. Do a sleep test. And it can be a simple thing. There's an app called Snore Lab where you can record your own breathing. You get 5 free recordings, Snore Lab on iPhone, and you can find out if you're gasping or choking or tossing and turning or snoring a lot. And it gives you an idea. If you're waking up continually unrefreshed, then you should talk to somebody like myself who has a background in sleep. Because then we can evaluate that. One of the first lab tests a person should do, in addition to blood work, is a sleep test, because that's where we identify how well does my body heal, or what kind of potential for healing do I possess. So look at those issues, and then create a plan with your provider to optimize your sleep quality, because as you do that, now the little sleep physician, the physician within your body, can wake up and start to do its job when your sleep quality has improved. For example, there's 3 stages of non-REM sleep and 1 stage of REM sleep, and each has important healing properties. And we need to have a certain amount of REM sleep, which is about 20% of our night. That's where our muscles are fully relaxed. And how would that be, Bree, if you could get those muscles in the pelvic floor to fully relax so that they can be perfused with blood and nutrients and restored, and just all that wonderful work that you do all night long, the body is doing therapy on your patient. And then, hopefully enough non-REM stage 3 sleep, which is where growth hormone and prolactin secreted most of the night. But they don't get that if they're having pauses in sleeping all night because their airway doesn't work, or they have injuries they're dealing with, or PTSD. And so their sleep quality then is diminished. So that would be the message: is there is hope for you. There's no person in this world that is as smart as your body is in healing itself. We try our best. We do our very best, don't we? Do our best. But if we can partner with the body, then we have a real shot of healing any condition that is capable of healing in the body.
Yeah. I often tell my patients, my job is just to help your body get out of its own way, because I feel like it gets stuck in some sort of process. And it's my job just to help it get out of its own way so that it can heal.
Yeah.
Yeah.
No, I love that. Your patients are very fortunate to have you.
Yeah. I agree. And you as well. It's such a neat thing. There's been the whole movement for mouth taping. What are your thoughts on that?
Excuse me. I think you need to be careful with it. I personally do mouth taping maybe 30% of the time. And if you nose breathe well, if you're confident that you do, then you can go ahead and do it. And the technique of mouth taping is really important. You never use duct tape and cover your own mouth, at least my opinion. You do things to clean and clear your nose before you mouth tape. And you should really do a sleep test before you do any of the mouth taping, because you might be plugging the emergency breathing hole that your body's trying to use, and you might have an emergency event. But I think overall it can be safe. With children, you have to be more careful, of course. And if you're going to do it with your child, do it during the day. When I tape, I put it in the 11 spot, on the side. So it's not covering the entire mouth. versus all the way across. Just one strip here, one strip here. And it's interesting, the musculature around the lips tends to go, okay, I guess I need to calm down, so it relaxes. But if you put it over the Cupid's bow, that's a highly nerve-rich area that you want to avoid because you'll be irritated a lot throughout the night if you do that. And you'll want to tape with 3M micropore type tape you wrap a wrist with, or some K-tape. And I actually prescribe mouth taping to my patients on a fairly regular basis, but only after we've established patency through the nose, and we've got oral patency behind the tongue, and that's a way to keep the mouth closed and the tongue up on the roof of the mouth, suctioned there. You make a suction cup up there, and then the tongue doesn't collapse the airway quite as much. You have a better chance of breathing better. So it has a place if you do it right in the right kind of plan in there.
But I think often people just go in and like, let's try this, can be a little bit scary. It's
Yeah,
like this. You need to make sure you can breathe well first, other ways.
that's right.
Yeah.
Absolutely. Yeah, that book by James Nestor actually is a really good one where he talks about the research behind mouth taping. And so that would be a good old reference.
So if we have someone that these symptoms that we're talking about are ringing true, where would you suggest they start? Do they start with a sleep evaluation? Do they start with an expert like yourself? Where is their entryway or their on-ramp into care for these issues?
Well, they could start with their primary care doctor. The issue is that they only teach about 2 hours of sleep medicine in medical school. And in dental school, I don't remember them talking about it at all. And so everybody has varying levels of knowledge and expertise. So I wish I could say everybody's well versed in the healing powers of sleep, but they're not. And everybody's so busy and everybody's doing the best they can. Um, but find somebody who has a background in sleep disorder. Um, when when you come to a person like myself, let's say, I'm going to give you the perspective of, let's identify the actual blockage of the airway. And let's go to the physician first to get the diagnosis. And if you heard somebody with my background that can help direct kind of where to go next, then that's helpful because then you're not pigeonholed into, you're on CPAP. And I can't tell you how many people just get thrown on CPAP. You got it. They don't. And I'll ask them, did they tell you where your airway's blocked? No, they just said, wear my CPAP. And that's a good thing because you're not breathing. So wear that dang CPAP. But really the next question is, if you don't want to be on that your whole life, then let's find out where you're blocked. So come to somebody who has a background in sleep like myself, and let's identify that and let's work in a team environment. And it takes a while to develop a team. I'm sure you know that well enough where you have a group of people who are like-minded, who genuinely care. And I've got a great team that does. And then I can activate it. It's like, okay, you're here. Let's get this figured out and who needs to help you. And at the end of all of this, you're going to be breathing, sleeping, body healing faster. So that's the key. You could go directly to a pulmonologist and get a sleep test done. But sometimes your insurance requires a referral from your primary care to that sleep doctor. So they can go. But if they find, hey, I'm just being told to wear CPAP, there are plenty of alternative to CPAP, and there's plenty of research to support those things. But there are some conditions like central sleep apnea where the brain doesn't even trigger breathing. That has to be identified, and that's a serious thing because you need to be on a thing called it's like a ventilator at certain times of the night too. So nothing to trivialize because there's a lot of serious medical problems like Alzheimer's, stroke, heart attack, diabetes, hypertension that are associated with the unmanaged sleep disorders. So it's good when people get trained and take it seriously.
Now, just some fun questions to close things out. What would you say is your favorite guilty pleasure for food?
Guilty pleasure for food. I like to buy chocolates. They're pretty amazing. They're expensive, but they're a fun little treat to
You
have
like the high quality stuff, huh?
yeah, right.
And then how about your favorite way to spend your time outside of work?
Oh man, it's playing with the grandkids. It's traveling with my wife Kathy all over the world. We love to go places. Tokyo, Taiwan recently, New Zealand. So love all that. Love learning about the world. It's amazing. Tasting good food too.
Culture takes on a whole different meaning when you're able to experience it in real time. Yeah.
Oh yeah, it's a big world out there for sure, and it's a lot of fun to see cultures and things and learn about people, history. Love it.
Well, thanks so much for your time this morning and for talking with me. I think it was fun to explore this kind of pelvic floor and jaw and sleep and breathing kind of connection that we have between the two. And I
Yeah.
really appreciate you joining us today and teaching us all about your specialty and your passion. And it was really fun.
Thank you, Bree. Wonderful to be with you.
Thanks for joining us today. I hope you guys learned a lot about the connection between the jaw and the pelvic floor, your breath, and your nervous system. It was a fun discussion between dental and pelvic floor physical therapists, and just assessing where it's like we have to look at the whole person. We need a team involved. We need to be looking at the root causes and really getting to the core of deep issues here so that we can really correct things and not just band-aid them. So we appreciate you tuning in today and hope you have a wonderful rest of your day.
Millions of women are still waiting for someone to take their symptoms seriously. You found this show. Share it. New episodes of Healing at Your Core release every week. Evidence-based, non-surgical, and built around one belief: you do not have to live with this.